Oklahoma ranks high in a recent survey, but it's not a ranking to boast. In fact, it points to a larger problem. The annual report from SAMHSA ranks Oklahoma number 2 nationally in number of persons in Oklahoma who have a reported mental illness. Also number 2 nationally in number of people defined as mentally ill, severely mentally ill. Joining me to explain what this report means and some solutions, Terri White, you are Commissioner of the Oklahoma Department of Mental Health and Substance Abuse Services, Dr. Brent Bell, Chairman of Behavioral Medicine at St. Anthony Hospital, and Traci Cook, Executive Director of the National Alliance on Mental Illness in Oklahoma, NAMI, I believe is the, thanks so much everybody for your time and for the analysis that we're going to get into on this report. And Terri, I'll start with you. Give us an overview of what this report is.
The report, and in some ways startling, although we know we have huge struggles with mental illness, shows that Oklahoma is number 2 in the number of people with severe mental illness. And that means over 150,000 of our family, our friends, our neighbors, and our coworkers. But even potentially more alarming is the fact that we are number 2 in the number of Oklahomans, or in the number of states who have had any mental illness within the last year, and that's over 635,000 of our fellow Oklahomans. And when you look at the rankings, note the states who were number 1 were different in each of those categories. So unfortunately what this means is Oklahoma has the biggest problem of any state in the nation, with a number of people struggling with this treatable disease.
And we're going to get into that later. There are some solutions to this,
Absolutely.
Which is the good news.
Yes.
But Dr. Bell, what was your thoughts on this survey?
Well, I'll point out that doesn't even include our children.
That's right.
That's
so this is
adults.
a survey of ages 18 and above.
Right. So, and that then you tie in the component of addiction, and so we have a huge problem, and it's an unmet need that we need to address.
Mm-hmm.
And Traci, what are you seeing from your group when you look at this report?
In our office, we take around 800 calls, emails, walk-in referrals every single month here in Oklahoma City. We are a statewide organization, so we don't just work with folks that live in the Oklahoma City metro area. We work with folks from all over the state of Oklahoma. And access is an enormous problem already. So when we're talking about not having additional services or losing some of the services that we already have, it panics me just a little bit, because I know that we're working with families and individuals, putting them in a holding pattern until we can find them services already. So it panics me a little bit. I'm not surprised that the number is where it is. We feel that on our very small staff every single week, but it's something that is treatable, and we've got to do something about it, and we know what to do about it.
Talk about the access statewide of what was it called? Beds?
Yeah, beds or outpatient services.
Okay.
Just like any other disease, because
Psychiatric treatment bed.
that's right.
Okay.
That's right. Mental illness and addiction are diseases like any other disease. They can be treated. Most people recover. But the difference for this disease is we have such limited access. In fact, only about a third of Oklahomans who need help are able to get it. So if you can imagine having any disease, heart disease, asthma, lung disease, cancer, and only a third of people in Oklahoma with those diseases got help or early access. Everyone else was waiting years potentially before they were able to get help from their initial symptoms. You can imagine how ill people are becoming when there's no medical care.
And what are you seeing access-wise, statewide? You were talking about there is a limited number of places people can go.
Absolutely, and beyond psychiatric beds, just getting into a psychiatrist or a counselor sometimes can take 30, 60, 90 days because of the lack of providers that we have and the lack of services that are available in our state. So absolutely, that crisis intervention, getting folks into those psychiatric beds is very important, and we do see the need for that. Unfortunately, my staff and I have become very good at helping people to put their loved one into a holding pattern until we can find something available for them. Unfortunately, it may not be in the metro area. We have to start looking at the entire state of Oklahoma and looking at the number of psychiatric beds we have in the state, not just Oklahoma City.
So when you have limited resources, limited beds, it really becomes, unfortunately, a matter of priority. Who is the most sick, I guess, in this case.
Absolutely.
And recently, just to give you an example, the Oklahoma City area lost about 50 adult and geropsych beds. The system was already stressed. So now, most nights, every bed in Oklahoma City, Tulsa, the entire state is full with people waiting. So it's just then we have the lack of outpatient resources also. So it's a crisis.
It's a crisis because it snowballs as well, right? This leads to other illnesses.
Right. One of the things we know is it's both the public and the private system, and I think that that's hopefully what Oklahomans and policymakers are going to hear is this isn't just a cry for people who don't have resources to get help.
Right.
Our public system is desperately overburdened, and we have our law enforcement partners driving all over the state with people in the back of a police car trying to find them help. But our private sector is completely overburdened. Dr. Bell can talk a little bit about actually the private sector closing some of their services.
Right, just the 50 beds we lost.
And then Traci might give an example of what it means to be a family member with private insurance.
I actually had a family member just a few weeks ago that we were trying to find a psychiatric bed for, and we were told there's nothing available right now. Can you wait till tomorrow? And having to direct an additional family member, okay, this is how you call 911. This is what you do. This is, you're going to have to know how to get the police involved because there's nowhere to go right now. And that's a family that has private insurance. That is not, somebody that's getting state services. So just what Terri said, the private side and the public side are both saturated, and we've got to do something. The thing that we know about funding mental health is it works. And it not only saves our state money, it makes our state money. So we know that investing in this problem that is treatable, that recovery is possible, and we know what to do. We have evidence-based practices that work for individuals that have mental illness. It is an investment that pays off. So, as a taxpayer myself, I mean, that's where I want my money going.
I'll give you an example of good early treatment prevents further problems. We know in Oklahoma the average person that has untreated mental illness or chronic mental illness may die 20 years younger than somebody who does not have mental illness.
Because that could lead to overeating.
It leads to addiction issues or smoking, or they don't get their health care, they don't get care for heart disease or diabetes. So that just compounds. So many people now present and they need help with mental illness also have all these medical comorbidities that have to be addressed. So it's a snowball effect.
Absolutely. And as Traci mentioned, taxpayers, we end up paying more as taxpayers in the end. When people can't get help, not only do they become more ill, but what you see them entering the criminal justice system. You see more kids entering the foster care system. You see more people backing up in the emergency rooms desperately looking for a bed when all the beds are full. And taxpayers pay more for all of those consequences than they pay, believe this or not, very clearly the research shows for the low cost of treating people early. But because we have limited resources, what ends up happening in our system and all of our systems is we treat those who are most ill. Those people who are maybe suicidal or at risk of hurting someone else because of their mental illness. And those people who are early in their disease, when we can have the biggest, easiest effect, we say, we're sorry you're not sick enough right now. We have got so few resources, we have to help those people that are in desperate need, and we turn people away every day. And then they become more ill and more ill and more ill, and then we end up paying for those consequences 5 to 10 times over.
Terri, define for us the illnesses included in mental illness.
Yeah, so when you think about severe mental illness, it's things like schizophrenia, major depression, bipolar disorder, severe anxiety disorder. Certainly, Dr. Bell, you might want to add some from the medical perspective.
That covers most of the major mental illnesses. But I'll tie that into, that crosses right over to addiction too. Yes. There's a crossover between the two. So the earlier you treat one or the other, it's a cost-saving benefit. And we have a lack of addictions treatment here in Oklahoma also.
Yeah. And like any other disease, and I think sometimes people don't understand this because for whatever reason there's a mythology or a stigma that's developed around mental illness and addiction. Even though they're diseases just like any other, it's just a different organ in the body. It's the brain, and we would probably all argue the most important organ in the body. Right. These diseases are preventable. But we're not even doing early intervention. We're dealing with this when people are very, very ill. We aren't even really being able to focus on the prevention stage. And these diseases can actually be prevented the same way they can be treated.
I think one of the most important things we can do with this report too is talk about children. We talked a little bit about children and adolescents who are not included in that report. So the number is well above that because we know 1 in 10 children in our state has a diagnosable mental illness, and most people don't even know what that is. I've had phone calls to the office that, of family members that say, well, my child doesn't have mental illness, they just have ADHD. And so I educate them that that is a disease of the brain, that is a mental illness. And so we have that conversation that there are many different types of mental illnesses. And in your child, they may be mild or moderate right now, but these are the adults of tomorrow that will be in those numbers. And so we have to do early intervention, just like Dr. Bell said. We've got to start teaching people what prevention looks like and educating them. And that's where those outpatient services come into play, is counseling services, may or may not be medication, but definitely getting families and individuals educated about what self-care and what prevention looks like, because most people don't know. They really don't.
And helping people understand that mental illness isn't those people. It's not someone else.
Well, that's what I was about to ask. There's a stigma attached to those two words, mental illness. Well, that's not me.
Right.
But chances are everybody faces a little bit of that.
Absolutely, and it's in every one of our families or ourselves. It's very common. Basically, in the end, when you look at all the data between mental illness and addiction together, which Dr. Bell has been such an eloquent job of explaining the connection, it's 1 out of every 4 of us in Oklahoma. It touches everybody.
So it's one of us.
It's absolutely, and it touches everybody, and it doesn't discriminate based on socioeconomic status. It's children sitting in the classroom of private schools, classroom of public schools. It's adults in the workforce. The majority of people with mental illness and addiction can and do work unless we let their illness get so severe that they can't. It's our servicemen and women and our veterans. When you look at the rates of PTSD and addiction among our servicemen and women, the people that we look at to protect us and are strong and are all those things, but they also struggle with this disease. Everybody does.
And Terri, we didn't even mention that the opiate prescribing in Oklahoma, there are more opiate prescriptions prescribed in Oklahoma than any other state. And we have a huge opiate prescription drug abuse problem in Oklahoma. And I think that's something that ties right into the mental illness part. I mean, you can't separate them at times.
That's true.
Well, guys, I'll get you out of here on this question. We rank number 2. How do we improve the ranking?
That's the thing I think is so important that I hope policymakers and the general population take away from this discussion today. The thing is, we can change it. It comes down to a couple of things, though. It comes down to getting people early access, which means, and this is always the most popular topic and fun thing to talk about, it means funding these issues. And while we've seen an increase in funding the last couple of years, we have decades of neglect that we've all watched happen in the mental health and substance abuse system. And if we are not going to treat this like the serious public health crisis it is, and I would argue it is the biggest public health problem facing our state, the health of our brain, mental illness and addiction, the fact is we're funded at about $53 per capita in Oklahoma. The nationwide average is $120 per capita. We're funded $46 per capita as a state, and yet, as you're pointing out, we have the number 2 rate in the United States. And if we don't address that issue and get people early access, it's not going to change. But if we do, it can. People can and do recover.
Well, guys, thanks so much for your time. I enjoyed the conversation, and I learned a lot, and hopefully we can raise the level of awareness and education as well. Thanks so much, guys. Appreciate it.
Thank you.